Have you been in an accident, collision, or a fall, and you're wondering if you have whiplash? Well, if that's the case, you come to the right place. There are different types of whiplash injuries, and here in Alberta, we grade them out of 4. In fact, they're not really called whiplash, they're called whiplash-associated disorders. This is because the mechanism of injury is a whiplash-type mechanism, and there's associated disorders with these type of injuries. Oftentimes, that may include neck pain, dizziness, headaches, numbness, tingling, arm pain, shooting back pains, falling down, jaw pain. There's a wide slew of possible injuries that can happen. So how do you determine if you have a whiplash injury? Well, there's 4 grades of whiplash injuries. These are graded 1, 2, 3, or 4. Grade 4 is if there's some type of pathology, such as a fracture. If you fractured one of the vertebra or bones in your neck, that's a grade 4 whiplash injury, and I really hope that hasn't happened to you. Grade 3 is when there's some type of neurological compromise, such as a frank herniation that's compressing that nerve, and now you have no strength, you have a lot of pain in the arm, no strength in it, you're dropping things, there's just nothing there. Grade 1 is when you have some type of soreness, but there's no objective deficits. For example, you have full range of motion, a little bit of tenderness on palpation, such as touching that area, but otherwise everything seems to be fine, no neurological issues. Grade 2 is a majority of these type of whiplash injuries where there's some type of pain or problem and there's objective findings, such as decreased range of motion, soreness, pain, and symptoms. So to answer your question, how do you diagnose whiplash? Well, are you having any real symptoms or issues after the injury? And if that's the case, then it may be whiplash. Of course, I can't diagnose you through this video, and really only a physician, chiropractor, healthcare providers that are able to diagnose can diagnose that. We always like to try to rely on Dr. Google, but it may not always be very accurate. So if you think you have a whiplash injury, I would strongly suggest you see your primary healthcare provider, chiropractor, physiotherapist, or your family physician to get that checked out to make sure you can make a full recovery as good as possible. I hope that helps. If you have any questions, reach out, send me an email, drop a comment in the line below, and have a fantastic rest of your day, and talk with you soon.